I am
The public?
In public health.
My son was born at 34 weeks old, so he was the preemie, and we were in the hospital for a few weeks before we were able to come home. Once they discharged us, they set me up with a home visit. The reason I came to the public health center in the breastfeeding clinic is because my son was so tiny that I did have issues with the latch, and I was using a nipple shield, so they helped me get him from the nipple shield right onto my nipple. For me personally, everything has been amazing. From the home visit was huge when we got home with Grayson. I mean, up until then we had nurses in the hospital with any questions that we had, and then all of a sudden you take them home and you're on your own and you're like, oh my gosh, I have this teeny tiny little baby and I have to take care of him. And so, I mean, I literally lived about 5 minutes from the breastfeeding clinic in Guelph, so I was there all the time with Grayson because he was so tiny, and my other son carried to full term. So I kind of assumed when I had him that, you know, I wasn't going to have any problems. I already done this once before. And so I figured it'd be a lot easier, and it wasn't. Both kids, it took me probably a good 2 months before I actually had them latching and feeding properly. It gave me a huge sense of comfort. It built my confidence as a mom, and they were just such a big help for me. And even being able to just go in for the weigh-ins, even just little things like that, having someone to talk to, answer any of your questions, they were just there, and so I would recommend them.